Global Evaluation Evidence Synthesis. This is Alima. She's 8 years old. She lives in a place where clean water isn't always guaranteed, where school meals matter, and where a small cash crowd can mean dinner on the table. Her life, like millions of others, is shaped by programs designed to help children thrive. But how do we know what's working, what's not, and why? And how can we do better? At UNICEF, we turn to evidence. Over 600 UNICEF evaluations conducted between 2018 and 2022. That is why we created the Global Evaluation Evidence Synthesis and Gap Map, to zoom out, connect the dots, and get a better view of the evidence landscape. Because behind every report and statistic is a child like Alima, and every insight helps us serve her and every child better. To understand how programs shape children's lives, we looked across 5 key areas: health and nutrition, education, child protection, water, sanitation and hygiene, and social protection. Goal Area 1: Health and Nutrition. Evaluations showed that health awareness campaigns helped families protect their children. Health education and community outreach made a real difference, improving survival and access to care. Progress still needs to be made in reaching families in remote or linguistically diverse areas. Strengthening health systems with timely data and clearer coordination among partners can enhance service delivery. Goal Area 2: Education. Cash transfers helped families keep children in school. Investments in school buildings and teacher trainings, especially for women, created better learning environments and helped more girls enroll. Building on this momentum, programs can focus more on tracking learning outcomes and digital access, especially during emergencies. As support schemes evolve, it is important to ensure that children continue to benefit from complementary services like school meals. Goal Area 3: Child Protection. Specialized services gave children and families safe spaces to seek help. Community outreach and awareness campaigns helped reduce risks and encouraged reporting. Continuous progress depends on addressing resource constraints and improving support structures. Reliable baseline data and consistent follow-up are essential to measure impact and sustain gains. Strengthening systems and investing in consistent follow-up are key to ensuring children remain protected over time. Goal Area 4: Water, Sanitation, Hygiene and Environment. Community-led sanitation efforts empowered families to build and maintain facilities. Menstrual hygiene support helped girls stay in school, and disaster planning made communities more resilient. However, short-term emergency responses sometimes took precedence over lasting solutions. Gaps in access to menstrual products and water scarcity also limited behavior change. More inclusive planning and robust systems are needed to ensure long-term progress. Goal Area 5: Social Protection and Poverty. Partnerships between governments and civil society have strengthened child-focused social protection systems. Public finance reforms have supported more equitable service delivery and laid the groundwork for inclusive growth. Expanding training for frontline workers and diversifying funding sources will help sustain these efforts. Inclusive planning and better data will ensure that all children, including those with disabilities, benefit fully from poverty reduction initiatives. Moving forward, how can we better help children like Alima? From these insights, the synthesis points to several key actions that can strengthen results for children in their everyday lives. Put children's rights and voices at the center. Foster cross-sector collaboration so no child is left behind. Communicate more clearly. Coordinate more effectively. Design for long-term impact, not just quick fixes. Strengthen data systems and transparency, encourage learning and innovation, and improve how we plan and use evaluations. To make real progress, we also need to fill in the gaps in what we know. That means starting with better information, like knowing where we began, tracking how things change over time, and making sure we understand the long-term effects of our work. This is especially important for children who are hardest to reach, Without these insights, we risk missing key lessons about what's helping and what's not. This global evaluation evidence synthesis isn't just about measuring progress, it's about guiding it. Because behind every program, every evaluation, every recommendation is a child with a name, a story, and a future. Children like Alima deserve to grow up healthy, to learn without barriers, to live in a world that believes in their potential. And for her, and for every child, progress must not just be a goal, it must be a guarantee.